Now let us talk about the various diseases that occurs due to phagocyte dysfunction, which ultimately lead to the various immunodeficiencies. So the disorders that occurs due to phagocyte dysfunction are leukocyte adhesion deficiency type 1, Chedick-Higashi syndrome, and chronic granulomatous disease. So these are the three diseases that occurs due to phagocyte dysfunction, which will ultimately lead to the immunodeficiencies in our body. Now first of all, let us talk about the leukocyte adhesion deficiency type 1. So the main defect in the leukocyte adhesion deficiency type 1 is the LFA1 intriguin, which is CD18 protein on the phagocytes. So there is impairment of the migration and the chemotaxis, and it is the autosomal recessive disorder. The presentation in this deficiency is that there is the late separation greater than 30 days of the umbilical cord, and there is absence of the pus and dysfunctional neutrophil, which will ultimately lead to recurrent skin and mucosal bacterial infections. The findings in this deficiency is that there is increased neutrophil in blood and absence of the neutrophil at the infection site, which will ultimately lead to the impaired wound healing. In the Chedick-Higashi syndrome, there is defect in the lysosome trafficking regulator gene, LYST gene, which leads to the microtubule dysfunction in the phagosome lysosome fusion. It is autosomal recessive disorder. So the presentation in the Chedick-Higashi syndrome is that there is progressive neurodegeneration, lymphohistiocytosis, albinism, which is partial albinism, recurrent pyogenic infection, and peripheral neutropathy. The findings in this syndrome is that there are giant granules. You can see in this picture also, in the granulocyte and the platelets. There is the pancytopenia, and the mild coagulation defect can be seen in this Chedick-Higashi syndrome. Now let us talk about the chronic granulomatous disease. So this chronic granulomatous disease I have discussed in brief in the respiratory burst also, that occurs in the phagolysosome of the neutrophil. What happens is that in the chronic granulomatous disease, there is defect of the NADPH oxidase, which leads to the reactive oxygen species. One of the examples of the reactive oxygen species are superoxide, and there will be the decrease of respiratory burst in the neutrophil. The X-linked form of the chronic granulomatous disease is the most common one, and the presentation is that there is increased susceptibility to the catalase positive organisms. The findings in the chronic granulomatous disease are there will be the abnormal dihydroamine test, and nitroblue tetrazolium direduction test fails to turn blue in the chronic granulomatous disease. So we concluded our various disorders due to phagocyte dysfunction. We discussed about the leukocyte adhesion deficiency, Chedick-Higashi syndrome, and chronic granulomatous disease that occurs due to phagocyte dysfunction, which will ultimately lead to the various immunodeficiencies. I hope you understood this topic on the phagocyte dysfunction. Thank you.